Thank you so much, Emily. I really appreciate the honor of being a part of this and also being a moderator. I just wanted to introduce CHICS for those of you who don't know it. It stands for Climate and Health Initiative for Children in Kearsarge and Sunapee. The goal of the project is to protect the physical and mental health of young children in the face of a warming climate by creating a grassroots, cross-sector, and community-engaged model that can be replicated elsewhere. And I'm now thrilled to introduce our guest speaker, Dr. Lisa Patel. She is the Executive Director of the Medical Society Consortium on Climate and Health and Clinical Professor of Pediatrics at Stanford School of Medicine. She's a former Presidential Management Fellow for the Environmental Protection Agency, where she coordinated the U.S. government's efforts on clean air and safe drinking water projects in South Asia in collaboration with the World Health Organization, receiving the Trudy A. Specinar Award for her work. She's a member of the Executive Committee of the American Academy of Pediatrics Council on Environmental Health and Climate Change, and a faculty mentor for Stanford Climate and Health. As a mentor, she works with students and residents on projects related to climate resilient schools, environmental justice, sustainable healthcare, and medical education curriculum reform. Lisa received her master's in environmental studies from Yale. It's from the School of the Environment, her medical degree from Johns Hopkins, and completed her training in pediatrics at UCSF. So without further ado, Dr. Patel, welcome to New Hampshire.
Oh, it looks like you're on mute.
I'm on mute. Thank you, Dr. Sherman. I really appreciate the introduction and the invitation here. And I will share screen to get us started. All right, no financial conflicts of interest to disclose here. And what I'm hoping to cover together in this hour that we have is to talk about the ways the fossil fuel industry negatively impacts human health, talk about why climate change worsens health inequities, and identify ways to advocate on climate change on an individual, community, and policy level. I don't think I need to spend too much time talking to this audience. You're all here on, a Tuesday evening, so you understand that climate change is here. It's now. It's us. I actually started studying climate change when I was in college, and this was 25 years ago when we were talking about it like an issue for the polar bears. And actually, we just did a visit to Senator Dianne Feinstein's office, where they have a whole pamphlet on climate change, where the polar bear is up front and center on that pamphlet. But I want us to reframe our thinking around it, because it is foundationally not an issue for a distant species in a distant time. It is the most profound health factor that's really going to determine our health for the 21st century. So I really like this graphic from the Lancet Countdown as we really step back and think, what kind of world are we trying to create? Are we trying to create a world where children can merely survive, or are we trying to create a world where children can actually thrive? And forgive me, I will be biased here. I'm a pediatrician, so I'll talk a lot about kids and pregnant individuals. So again, as we think about this world, I think many of us that work in the field of climate change, we see a lot about this left side of this, right? We talk about how climate change is making our world polluted. We feel isolated, harmful, inequitable, unsightly. This is what's come from being an economy that is reliant and dependent upon fossil fuels, a dependence that's been built and maintained by the fossil fuel industry. But the world we're trying to create, it is worth imagining and creating a world that is beautiful, clean, connected, healthy, just. As we think about these transitions to renewable energy and away from the fossil fuel infrastructure, this is a vision of a society that really connects us and the kind of world where children could actually thrive. I'm going to focus very narrowly on two issues as it relates to climate, health, and inequity tonight, which is heat and wildfires. But I do want to just point out that this isn't just a domestic issue. This is an issue that's affecting people worldwide. So whether it's severe drought in parts of the world like Madagascar, where 1 million people are on the brink of starvation, the fact that island nations are going to disappear, certainly in my time and definitely in my children's lifetime, the historic monsoon season, a third of Pakistan was underwater, and they're still recovering from all of that damage. wildfires, which have always been the natural part of ecosystems of some places, but now have spread in severity and scale into new places. And so in places like Spain, they were battling wildfires in places that they hadn't encountered before. And this just really struck me. You know, I've spent a lot of time in South Asia. My parents are from India, and the fact that birds were literally dropping dead from the sky this past summer because it was too hot for them to even survive it. I always like to point this fact out, especially when I'm encountering leaders that don't understand that this is a health issue, to show that there is really broad consensus. So in the fall of 2021, 200 major medical journals, in an unprecedented move, published the same editorial on the same day, calling climate change the greatest threat to public health in the 21st century. And so this isn't a question of we're still debating. It is a profound human health threat, and one that the healthcare sector really needs to mobilize around. I'm going to get back to this statistic, but I want to plant this one in your mind as really a concrete action that we can take. As you can see, in these little buckets of people that are very concerned, somewhat concerned, a little concerned, they've shifted over time, even in the last 10 years. And that's because we are living out the effects of climate change in a way that we can no longer deny. So that bucket of very concerned has been growing over the years, but you can see that 3/4 of the country is very concerned or somewhat concerned. But now look at this gap between how many of us are concerned about climate change and our perception of how much others are concerned. And my theory on this is that climate change feels like such a big problem. We maybe just shove it away in a part of our mind and don't talk about it as often as we can or we should, because sometimes the problem feels too big or too overwhelming, and we don't quite know what our place is in making this world better. So now I'll turn to talking about climate change and health. And I think many of us have seen this graphic in the past, and I'm not going to go, obviously, I'm not going to go into all of this in just the time that I have, but I did want to point out that there are, each of these could be multiple lectures as we're thinking about the myriad ways that climate change affects human health. So thinking about things like severe weather, for us here in California, we've had these atmospheric rivers come through that we don't know yet for sure whether they're driven by climate change, but we have seen what Catherine Hayhoe calls it global weirding, and things have sure been weird for us here. Hurricane force winds, a tornado in Los Angeles, which are things that we have never encountered in the past. And that's just California. In other places we're seeing where tornadoes are occurring, shifting, we're seeing more flooding, we're seeing these huge superstorms that drop massive amounts of precipitation that not only displace people, but keep them displaced because one disaster after another would come through. So when we're thinking about things like environmental degradation and degraded social living conditions, I think about places like Lake Charles in Louisiana, where they had one hurricane come through, a chemical plant explosion, another hurricane come through. And these are communities that have a higher percent of minoritized population. So before they even have a chance to recover, the next disaster has come through, making it even harder for communities to be able to rebuild. Changes in vector ecology, that too is its own whole area of expertise and learning. We're seeing mosquitoes and ticks spread into places that we haven't previously seen them. And with them, they take these vector-borne diseases into areas that have previously not encountered them. And then impacts on water and food supply and water quality impacts. For folks that were following what was happening in Jackson, Mississippi, this was an area, again, a higher percent Black population, years of disinvestment in their public infrastructure in terms of sewage and drinking water. Well, that system essentially collapsed when there were a series of floods that came through it, probably as a result of climate change. And now you have a major city in the United States where they did not have access to potable drinking water, which is insane. So I'm going to focus more on heat waves and wildfires and air pollution, because these are issues that touch on all of us. And I think they're issues where there are really great both evidence and examples of how climate change is deeply an issue of health inequity. These are just some pictures of what we're encountering, roads in India getting warped because of the heat. I actually we had a heat dome in the Bay Area in September, similar to the heat dome that Oregon and Washington encountered in 2021, where my hospital is in Livermore. It topped 116 degrees. I'm a pediatric hospitalist and I work 24-hour shifts. So I was actually working 2 24-hour shifts over that Labor Day weekend during our heat wave, and it was two of the worst shifts I've had in a long while. The number of kids that were coming in with respiratory distress. I go to deliveries where the baby might be in trouble, and there are a number of pregnant individuals where they had fevers, but it could be that the rooms were just overheated, lots of meconium deliveries, and I ended up admitting a number of children into our neonatal intensive care unit during those two shifts. I really like this reporting that came out of the Washington Post for the heat dome that happened in Oregon in 2021. They wrote, physicians raced to provide fluids to patients who arrived breathless, dizzy, and drenched in sweat. Others were brought in on stretchers, their body temperature so high their central nervous systems had shut down. Those who could still speak told of stifling apartments and some that made their skin sizzle. Some had tried to walk to counting cooling shelters only to collapse in the blistering heat. So as I mentioned, it reached 116 in places like Portland, 116 where I was practicing in Pleasanton. They've actually done studies on the human body in terms of what we can handle for heat. And a otherwise healthy adult with no medical conditions, at rest, wearing light clothing, drinking water continuously, and with minimal humidity can handle 115 degrees, and it got to 116 in these places. There are vast parts of the Middle East and Southeast Asia that are going to exceed what we call the survivability threshold by the middle of the century, is what's predicted if we continue at this pace of warming. It should be no surprise that heat waves are worsening in terms of frequency, duration, when we are seeing these heat waves come, and heat wave intensity. And these come with again, a number of really concerning health outcomes. So there are excess deaths during periods of heat wave. We know that heat waves really affect children, elderly, and the poor, and the projections anyway are 150,000 Americans could die as a result of these heat waves from climate change. As we think about, as we as healthcare workers, clinicians, think about which populations are the most vulnerable in terms of these heat waves, I like to break it up by thinking about those populations that are vulnerable by physiology. So infants, elderly, and disabled, and I'll talk more about that in a second. But then we also need to be thinking about the populations made vulnerable by racism and poverty. A very good example of that is the 1995 Chicago heat wave, when a disproportionate number of Black Americans died. They actually did some work after the heat wave to try to understand the factors for this, and went and did a lot of community surveys. And what came out of it is that a number of residents didn't feel safe so much as opening their windows. They lived in over-policed neighborhoods. And so people basically baked inside their homes because they didn't feel safe opening them. Layered into this as well is that we have to think about things like access to air conditioning, places that have higher housing crisis. I'll say I was actually looking at this data for this talk. New Hampshire is actually doing better than some of its surrounding states in terms of its housing crisis. We obviously have a very big housing crisis here in the Bay Area, but you can see some of the surrounding states are having worsening problems with homelessness. And the way this plays out is on days of excessive heat, if people don't have safe places to cool down, it can drive them into heat stress, heat strokes that lands them in the emergency room. And so for us here in the Bay Area, and I don't know what air conditioning coverage is in New Hampshire, having access to air conditioning is one of the most protective factors for a family in terms of staying safe during periods of heat wave. And so we've done a lot of work here on thinking about places of community cooling because we have pretty lower rates of air conditioning. It's not something that our climate has traditionally needed, but it is something we will need more of as we move forward in this warming climate. And then finally, there is where people live and how that contributes to heat as well. For the folks who are not familiar with the practice of redlining, this was done by the Homeowners Loan Corporation in the 1930s. They literally drew red lines around areas that have a higher percent minoritized population, primarily Black Americans, and would not give loans to those areas. What ended up happening as a result of that, and this persists, by the way, these disparities, these areas were slowly divested from. So these areas tend to have less access to good paying jobs. They tend to have more concrete, less urban tree canopy. And you can actually see it in the mapping. These places are literally hotter. This is data from Oakland, and there have been studies that have shown the same pattern in many other cities in the United States, that areas that are richer tend to have access to more urban tree tree canopy, areas that are poorer, and these tend to be areas that have been historically redlined, tend to be physically hotter, up to 7 degrees hotter on a hot day compared to areas that are cooler. So that means that we're battling a few things at the same time. Households that don't have access, that tend to be poor, may not have access to air conditioning, may not be able to pay their energy bills, and on top of it are likely to live in neighborhoods that are physically hotter because of structural reasons. Then when we think about physiology and which populations are more vulnerable by physiology, so pregnant individuals are at higher risk for adverse birth outcomes, and I'll talk about that paper in my next slide. Infants in particular cannot effectively thermoregulate in the first week of life, which places them at high risk of death. This was a study that was done in Spain that showed a high risk of mortality in that first week of life, because infants in that first week, an infant, for example, can't kick off the blanket if they're too hot, and they do tend to have more immature thermoregulation in that first week. I have cared for a number of infants over the years who came in dehydrated. Either the parents were giving them water because that's what they thought an infant needed, or they would overbundle their infant. And I remember caring for a teenage couple that had had a baby, and they hung on every word we said because they were young and they felt like they didn't know what they were doing. And they took their child back to an unair conditioned apartment in Oakland, dressed the baby as the nurse had asked them to, and the baby got overheated in their apartment and came in, and we had to rehydrate this baby. And they were tearful. They were saying, we did everything we were told, and we still hurt our baby, and really just like a loss of confidence in themselves. And it really drove home the point to me that we as healthcare providers haven't really been taught to think about the environmental threats to our patients in the counseling that we do. And then outdoor workers may not have protections in place or places to cool down. Very tragically, during the 2021 heat dome in Oregon, an outdoor farm worker collapsed and died. And it took a situation that extreme for Oregon to start considering legislation to better protect outdoor workers during periods of extreme heat. I've cared for a number of athletes who have come in who just got tipped over by like a few different degrees in terms of their practice that came in with rhabdomyolysis or a breaking down of their muscles that required rehydration. I cared for a 16-year-old who came here unaccompanied from Mexico, who's hauling brick in 108-degree weather, who came in with his creatinine tripled. Now, my patients are young. I can usually reverse the kidney damage pretty quickly, but what the evidence shows is as these outdoor workers or athletes face these types of insults again and again and again, it can cause chronic kidney damage down the line. This was a great study that came out by Bakar et al. That looked at a few factors together. So air pollution, heat, and the risk of adverse birth outcomes. And it found that heat and air pollution are associated with preterm birth and low birth weight infants with marked racial disparities in outcome, particularly in Black and Hispanic women. And these disparities are multifactorial. The study wasn't able to separate out all the various factors, but we know what some of them are. It's higher exposure to air pollution from historical redlining, poorer access to prenatal care, and the toxic effects of racism on mothers' health. So how do I, as an individual clinician, take this and act upon it in terms of my counseling? So I've learned over time what my cooling centers are. A few years ago, when I started doing this research and mapping, this was when the pandemic hit. And there were, at the time, I think we were very young in this journey. And so they, in my county, they had just basically taken a gymnasium, put some folding chairs into it and turned the air conditioning on and expected people to show up. We now understand that is hugely disrespectful of people and how they want to spend their time and where they want to be. And so there's a lot more intentional mapping now to create community sites of resilient climate resilience to meet people where they are and where they might derive some benefit or service. So thinking about our public libraries, thinking about our schools, thinking about like a rec center, for example, in Alameda County, they've created a youth rec center that is climate resilient for youth to be able to show up on a hot day and be able to access their library or other services, for example. But this is the kind of work that every place needs to undertake now, because getting everybody access to air conditioning will probably not even be possible. But what the counseling that I do now is that we've done a lot of work in our counties on more access to cooling centers. And so I have those resources now, and I do provide them to my families, particularly around the spring and summer, so that they have safe places to be in case it's a really hot day. Another thing that we can do as providers, I just wanted to shout out this resource by Virginia Clinicians for Climate Action. They actually worked with their Department of Public Health to develop a set of materials that they can distribute through the clinic on how to keep athletes in particular safe. But depending on which population you're trying to reach, there's a possibility to create these kinds of materials and cater your counseling depending on what the risk factors are for the population that you're dealing with. As we think about our very urban landscapes, the areas that are concrete jungles, I just wanted to lift up some examples on places that are really thinking about how to mitigate things like heat island effect. So there's the park over the highway in St. Louis, the Highline Park in New York that took an old railroad and turned it into a long continuous parkway, the Central Artery in Boston that was torn down for the Rose Kennedy Greenway. I'd like to think about what good came from this pandemic. And I think one of the goods is that we're seeing a lot more. We understand the how much it has been good for us to be outside more, and so I know we as a city in San Francisco have invested more in streets that are shut down from cars, from more parklets, for example. So these are just some examples of ways that we can affect our local community to create more of those green spaces to decrease the effects of heat for the residents that live there. Any questions on heat before I turn to wildfires? Great. So wildfires. These pictures are again Bay-centric, but this is an issue that's going to touch on all of us, and I'll talk a little bit about why. But these were from the Paradise wildfire that happened in 2018. That top is the San Francisco skyline, and the bottom is that same skyline during the wildfires. We had air quality that rivaled places like New Delhi that don't have the same laws and regulations in place to keep the air clean. These just horrific pictures of absolute destruction. And this picture, the satellite picture, felt remarkable in 2018. Unfortunately, we have seen many scary things from satellite imagery in terms of our weather since then. But at the time, it was pretty remarkable that the plumes of smoke were so large we could see them from space. And again, this is a global issue. Places in Greece that hadn't encountered wildfires as severe were on fire. The permafrost, which is an area that's supposed to be cold and frozen, was ablaze as well. Globally, wildfires are increasing. Now, I know I've given a lot of doom and gloom, but just to inject a little bit of hope, this graph, these series of maps, is what would happen if we had no plan in place for emissions reductions. So this map is no longer valid because we passed the Inflation Reduction Act, which gets us to 40% of our carbon emissions by 2030, which is huge. We are still on a trajectory towards worsening wildfires, but a slightly improved one from the dire picture that this one presents. This one presents a prediction of a 74% increase in the frequency of wildfires by the end of the century if we don't meet our targets in terms of emissions, and not just the US, but globally. So why I'm very passionate about PM 2.5 and with good reason. We in medical school, we spent so much time learning about the Krebs cycle and these things that don't really have a lot of clinical utility to me in terms of our practice. And I never got a single mention of PM 2.5, which has huge implications in terms of my patient's health. PM 2.5, when we burn anything, whether you're burning fossil fuels or whether it's a wildfire and the house goes up in flames, well, it creates these really little tiny particles that combine with liquid droplets. And they're so tiny, they're basically the width of a fraction of a human hair. We breathe those in, it enters our lung and our vasculature and essentially sets off an inflammatory cascade that we have very good evidence for what chronic exposure to fossil fuel pollution results in. And that's this graphic here on the bottom. Shorter life, stroke, heart disease, asthma, lung cancer, reduced lung function, low birth weight. Data is emerging on wildfire smoke that shows that we cannot treat the same, it's the same pollution, apples to apples, it is quite different. And the evidence is starting to show that wildfire smoke is 10 times as harmful compared to other types of air pollution. So what the study did was it took apples to apples. You take an air quality index of 50. But in one situation, you're dealing with primarily fossil fuel pollution that we're always breathing. In another scenario, you take an air quality index of 50 on a mild wildfire day. And what they found was that 10 times as many children showed up with respiratory complaints when the AQI was 50 as a result of wildfire smoke. Now, this shouldn't be surprising. You know, when you think about a house going up in flames, I mean, paint thinners and chemicals that enter that air, there's a much greater concern that the chemicals that get released into the air as a result of wildfires that burn are more toxic, more carcinogenic than the pollution we're breathing from fossil fuel smoke, well, fossil fuel pollution. We have gotten very used to looking at these air quality indexes within the Bay Area because wildfires have now more or less become a yearly occurrence for us. We got some respite last year. We're hopefully getting some respite this year because of all the rain that we've had this year. But I often get the question of, you know, is it okay for my kid to go out on like a yellow or an orange day during wildfire season? And what I tell them, my kids are now 5 and 8. So my 5-year-old has had 3 years of his life during wildfire seasons. The first 5 years of life are the most critical to his lung development because when babies come out, their lungs are not yet fully formed. And there's no data I have seen that reassures me that it's okay for him to be breathing even a day of this very toxic wildfire smoke. So I tell them what I do and say that public health still needs to catch up to this in terms of updating its guideline. But I think we need a separate AQI during periods of wildfire smoke to account for what the different health and worse health impacts are of wildfire smoke. So I've kept my kids in during yellow and orange days, even though the broader guidance says that it's okay for them to be outside, understanding that their exposure to this kind of toxic pollution is no longer a one-off. It's something that I can more or less expect to be a chronic exposure from them for here on out. What we see in terms of the health effects of wildfire smoke, and the reason why I say that this is an everybody issue is that wildfire smoke blows hundreds of miles, and as it goes, it gets more toxic because it gets oxidized by the sun. So most of the questions I actually get from people aren't within my state. I will often get questions from my colleagues in Montana or Wisconsin or on the East Coast where that wildfire smoke has blown into areas where they're not used to dealing with it and they don't know what to do with it, because it's not something they're used to dealing with. And so as these wildfires carry on in the American West, this is something that all of us should be aware of because no one can stay safe from where that wind is basically going to blow the smoke. And so some of the effects that we can see are increased asthma exacerbations, lower respiratory infections like pneumonia and bronchitis. And then there's emerging evidence on the links between wildfires and stillbirth and starting to be decent evidence on the links between wildfire smoke and prematurity and low birth weight. I've talked about wildfire pollution, but I also want to spend a moment talking about the air pollution that we're always breathing because we burn fossil fuels. And I wanted to just put this up as what I think we should not do when we talk about the disparities that we encounter as healthcare workers. So you can see what this lists that Hispanic children are twice as likely to die from asthma compared to a non-Hispanic white. A Black child is 4 times as likely to die from asthma as a white child, but it doesn't talk about why. And when we think about the whys, so there's redlining, as I mentioned, there is great data that shows that race independent of income, so being Black American is the greatest predictive factor for you being exposed to toxic fossil fuel pollution from the time these children are in utero. And so they start that exposure in utero, and there is good evidence for other minoritized populations and for low-income communities to also be more likely to be exposed to that toxic air pollution from the very beginning. So exposed to that pollution from the very beginning. Black families are less likely to be able to afford their asthma medications, more likely to encounter implicit bias when they enter our hospital clinic walls that results in differential care. And that is why we see these deeply unjust outcomes of a Black child being 4 times as likely to die from asthma compared to a white child. I don't know my way around New Hampshire well enough to talk about all the environmental justice issues there, but I did just want to talk about a few of our examples here as you're applying those lenses to New Hampshire. We, for example, have a Chevron oil refinery in Richmond, where that has resulted in flares that worsen surrounding air quality. I will say that it has been remarkable to see the community of Richmond come together to take down this common enemy. And there has been some really amazing and effective organizing and advocacy as a result of it that's been inspirational to watch. West Oakland, so this was a previously thriving Black American community in the 1930s and 40s that got encircled by a freeway to basically allow for suburban residents to drive into their jobs. What that ended up doing is throwing in all this pollution into West Oakland and basically cutting West Oakland off from everything around it. And now it's a very divested community compared to where it used to be. Children growing up in West Oakland are several fold times more likely to have asthma compared to their peers that live in the Berkeley Hills just a few miles away. Again, what has been born from this injustice is a really amazing group, the West Oakland Environmental Indicators Project, that is it's citizen science, led by the residents there, that has done some really amazing work and some really amazing advocacy to redress these historic injustices. And then in East Palo Alto, the East Palo Alto has there's always been a minoritized population that lives there, and that has changed over time. It used to be a higher Hispanic community. It is, a higher Black community. It has shifted to a higher Hispanic community. But what has been consistent is the treatment of East Palo Alto like a sacrifice zone. So when the county had the funding to build or had the opportunity to build this plant, they sited it in East Palo Alto. Thanks to youth organizing, they actually shut that hazardous waste plant down I think it was in the early 2000s. And I really like this quote from Hopkins, who says, "You can't have climate change without sacrifice zones, and you can't have sacrifice zones without disposable people, and you can't have disposable people without racism." The final piece I just wanted to mention as we think about climate change and air pollution and vulnerability, there's a study here that, again, we cannot separate the health of our patients from the social determinants of health that we know is a much greater factor and who has the ability to thrive. And what this wheel really does, I really like the way it lays it out. People who are unemployed, who have a lower income, less education, don't have access to a vehicle, certain age groups, for example, these individuals are at higher risk during periods of wildfire, and they are also less likely to have the access to resources to be able to flee afterwards. To rebuild afterwards. How do I take this on as an individual physician in terms of my counseling? Oh boy, it's already 2:35. Okay, I'm going to motor through this one actually, because I want to leave some time for questions. The last piece I actually want to mention is mental health. I don't think any of us can talk about health these days without talking about the mental health of our patients and our communities, because I am seeing a lot of suffering in my clinical practice in terms of mental health. We know that children need safe, stable, and nurturing environments to thrive, and disasters, particularly recurrent ones, expose children repeatedly to these events. We know that these worsening disasters threaten a child's both long-term physical and mental health. So we understand toxic stress. So these are things like poverty, racism, a caretaker that has a mental illness, not having access to stable and safe housing, for example. Each of these factors can rack up to cause toxic stress on a young brain that places these kids at higher risk for a host of health problems down the line: stroke, heart disease, diabetes, mental health issues themselves. And so climate change will take each of these factors and make them much worse. And so again, as we're thinking about a healthy world for children, the most we can do to create safe, nurturing spaces by addressing climate change is deeply important. I'm just going to skip ahead here. So I've talked a lot about how climate change is both our greatest health threat and our greatest health opportunity. I've talked a lot about why climate change is our greatest health threat, but now I want to switch to talking about how it is also our greatest health opportunity. And so I like this cartoon, like, what if it's a big hoax and we create a better world for nothing? And then we think about what it is we're actually trying to fight for. These things like energy independence, sustainability, livable cities, healthy children are worth imagining and fighting for. When I think about what really brought me into this movement, so I'm a mom to 2 young children. I finished my medical training, and I have this background in environmental science, and I kept thinking to myself, well, I'll get involved, when my kids are older, when I have more time. And then in 2017, we withdrew from the Paris Climate Accord. And I suddenly realized that there was no time, that if I didn't get involved right now, that the world would be ruined for my children. And so it was 2017 when I started to get more involved. And I had 1 child at the time, and now I have 2. But I, as a parent, feel as though, any one of us would throw ourselves in front of a bus to save those that we love. And that's how I look at climate change. It's like a big bus that's barreling down on the people that we love. Let's skip ahead to what can we as health professionals do. I think we all know that our voices are highly, highly trusted. And so we serve a very important place in terms of communicating with our patients and with communicating with decision makers. And so here's my 5-step plan for climate action. And I'll just walk through each of these. And one of the things you're going to hear me say over and over and over again is that climate change is a systemic problem that requires systemic solutions. This is not something we can solve entirely on our own. This is not something that is solved entirely by individual action. It is something we need to solve together, and it is something we need to address as a systems issue. And the easiest systems issue really is to vote. So I just wanted to lift up Vote-ER as a fantastic resource to have a nonpartisan conversation with your patients about voting. And then also next year to be really pressing the candidates that are running for office, asking them what are their solutions for climate change, and really pushing them to be as bold as possible. We at the consortium put out resources every year to help guide that discussion for folks. And this is from 2 years ago, but we'll be updating it next year for the presidential election. A second thing we can all do, and I think that y'all are pretty well engaged on this topic in terms of decarbonization, but if you're not aware, Health and Human Services has just reopened the pledge, thanks to advocacy from our state clinician groups, to ask your healthcare institutions to join this pledge to decarbonize. And now they're going to keep the pledge open indefinitely. And we're working with Healthcare Without Harm to work with our advocate network for people to reach out individually or try to get sign-on letters at your healthcare institutions. At Stanford, I worked with our student group and with our faculty to get 90 students, staff, and faculty to sign a letter that we sent to our CEO. And I think they were going to sign anyway, but we're going to take some credit and say it was because of our letter that our healthcare institution signed the pledge. Join a group. Y'all are here because you're a part of a group. So stay in this group. This is hard work. And there are times when we get to celebrate victories, but there are times when we fall down. And I found so much resilience and community working with groups, and for me in the Bay Area, for y'all here in New Hampshire, on how to learn these skills like writing op-eds and advocating to decision makers, but how to really build communities for change, because this is a long, long fight and it will take a while. And the more we can do together in community, the stronger we can be. The fourth thing you can do is to talk to counsel your patients about climate change. I have the benefit of being a hospitalist, so I have a lot, I can use as much time as I want to when I talk to my patients. A number of my colleagues live in pediatrics, work in the outpatient world, 15-minute visits, 30-minute visits, where there is no time to talk about climate. What I hear is that there's no time to talk about climate change on top of everything else that they're dealing with. One of my colleagues, Rebecca Phillipsborn, who is a very, very thoughtful pediatrician, wrote this fantastic piece, A Pediatrician's Guide to Climate Change Informed Primary Care, where she talks about opportunities to integrate climate change into the counseling you're already doing. So to not add a question, but to bring the climate lens to the questions you are likely to be talking about with your patients. So nutrition, physical activity, and housing are all opportunities to talk about climate change. And then fifth and last, I put set the example and tell others about it. The fossil fuel industry has done a fantastic job making us think that climate change is all our fault. And so then it's our individual behaviors that if you drive a car, your gas powered car, you're the problem, for example. And I just want to disabuse people of that idea. They have they have continued to foster our dependence on fossil fuel when they've long known the evidence that it was causing harm, and we've long had the solutions to transition off fossil fuels. So I'm telling you, you can eat your steak, you can drive your gas-powered car, and you can still be a climate advocate. Should you choose to take individual action, like biking more or reducing your meat consumption, what's more important to me than taking that action is telling others that you're doing it. Back to that graphic I was showing you about how many of us are concerned, but our perception that others are not. The more we talk about it and the more we show people that we are concerned enough to take action, the faster we can catalyze more public will and conscientiousness around this issue, get more people engaged, and get more people activated on the issue, which to me is the far more important thing for us all to do. The problem is big, but so is the opportunity for change. And so I encourage you all, if you want to join our newsletter, please click here, and we send out opportunities throughout the country and opportunities to do advocacy at more on a federal level. And I welcome your questions.
Thank you so much, Lisa. That was just an amazing presentation. I'm sure everybody else is wondering whether you'd be willing to share all or some of your slides with Emily, who can disseminate them or put them on the website, but they were phenomenal. I'm sorry I missed, I think there was a little cartoon that you had to skip over, so I look forward to going back and getting all the details. I would also, I have a question. I think there are questions coming up as well as citations in the chat. So please, everybody, take a look at the chat. But I have just a quick one. You know, when we think of what's happening in California and Oakland and Oregon and the western states with the wildfires, first of all, we are very heavily forested, and I think it's a matter of time before we start seeing that aspect of climate change. But we do have the jet stream, and one of the concerns I have is we got the brunt of the nuclear fallout from the open air nuclear testing in the 1950s. And so I'm just curious, how far does this particulate matter from wildfire smoke? How far does it actually travel? Can it make it across the country, or is it really something that is going to be deposited in Colorado or otherwise?
Yeah, I actually, I'll have to look this up, but I'm pretty sure I saw something that tracked some of the air pollution in the West all the way to Europe in 2021. So it definitely does at the least cross the country, and it probably goes even farther than that.
So it is a global impact then that
right.
you're experiencing.
Right, and the wildfires don't just happen here, right? There are huge wildfires in Australia, in Greece, and Spain. And so I don't think that there's a part of the world that isn't going to get at least some local pollution from the continent they're on. How much is Europe affected by our wildfires? Probably not that much, but they are probably very much impacted by the wildfires that happened there. But the other thing I'll say is what's tough about that is it depends on what that wildfire encounters along the way. So if there's a lot of rain, I mean, that's what washes it out of the sky, essentially. So it depends on what else is going on.
Great. Thank you so much. Bob asked, can you comment on indoor air quality and children's health?
This has been a huge, if folks have kind of been following what's been happening in the news and on Twitter, this became a big issue because of gas stoves. And both the AMA and APHA have put out statements basically saying we need to get off gas stoves for children's health. We know that gas stoves release a witch's brew of pollution that is not good for children, for pregnant individuals, for the elderly, those with chronic medical conditions, or really anyone. And so there's a big push right now to support the best we can a move to induction cooktops and away from gas stoves because of that indoor air pollution from gas-powered appliances. Gas stoves being the worst offender, but our boilers as well that are usually powered on gas, depending on what part of the country you're in.
And I think any approaches to eco-anxiety in children, what you use in your practice?
Yeah, I would say, so I'm a hospitalist, so I'm dealing with kids that are coming in crisis. And usually that crisis is multifactorial, but I don't get to the point of conversation with them to talk about, whether, for example, eco-anxiety is a part of that. But I would refer folks to the Climate Psychiatry Alliance. I think they've developed really fantastic resources in thinking about how to deal with eco-anxiety and eco-grief.
Does your institution have a group or a committee dedicated to healthcare sustainability?
We have an informal one. So 3 years ago, Stanford did not so much as have a sustainability program office. And this was in the setting of, in our healthcare landscape, UC had committed to decarbonization, Kaiser had committed to decarbonization, and we were woefully behind. So we organized with the students and residents and faculty at Stanford, and we started putting on a yearly symposium with UCSF and UC Davis. And what we really wanted to do, we invited our CEOs, got them all in conversation, and we told our CEO, we wanted to highlight Stanford as a leader, but what we really wanted was our CEO to hear what these other CEOs were doing. And that turned out to be a really powerful incentive. And 3 years later, we have a sustainability program office, we have a decarbonization goal. And this group is a little, it's students come and go. So there's a loose group of faculty that have stayed engaged on the topic, and then students that have come and gone with time. And we all get together a few times a year to work together, but we're not a formalized committee or structure. I would like us to be.
And there was a question, there's so much that patients are dealing with right now. And so how do you had mentioned a tool for adding climate change to the list. And we know that there was actually an early program when Bob was first launching Healthcare Workers for Climate Action. And I think I was a part of the panel on that. And the impact of a trusted partner, and I'm thrilled to see that nurses lead the charge, because that's always been my experience as a physician, is that the nurses are the ones that patients just really bond with in a way like almost no other. But that our role in being able to use that trusted partnership is undervalued, and yet it is hugely impactful in getting people to really engage and stop doubting or become a part of the solution. Has that been your experience, and how do you fit that into your quick encounter with the patient?
Yeah, I've kind of developed, I tend to see some of the same issues or problems over and over again in my practice. And so I've attached standard counseling depending on who I'm talking to. So with my newborn families, my kind of counseling is always around heat. I talk about how climate change is making heat waves worse, and I talk to them about access to cooling, and talk about ways to keep their babies safe, because we know babies are so vulnerable. For my asthmatic patients, I always talk to them about wildfire season. I talk to them about masking, about air purifiers within their homes. It's just become a standard part of how I engage with them on the topic. So and then in my prenatal counseling, I'll often get called if somebody's in preterm labor to tell them what to expect. And so I'll give my talk about, in some cases we medically know why someone's gone into preterm labor, but a lot of times we don't know. And so I'll put into my speech, what are some of the risk factors for preterm labor, and I'll talk about climate change as a risk. And so I find ways to build it into it does take some thought and some planning. And this is, I think, one of the barriers I've encountered from physicians who feel like they haven't gotten the training yet. And so it doesn't feel so easy for them to know where to plug and play or to put it in. That's why I really like Becca's paper, if you're in primary care, and I can dig up that resource for y'all, the paper, and send it to you, is that a lot of clinics, particularly in pediatrics, we do like a social determinant screen or a series of questions that you run through every time you see them, where you're talking about food insecurity, you're talking about housing, you're talking about how often they're exercising, and you can just build those questions in. But that's what I would say. It's like, find those plug and play opportunities. We're in cognitive overload in our patient encounters. And so the better you can kind of pre-plan and create those opportunities for yourself, the more likely you are to actually act upon it.
That's great. And, many of us think about what we can do in our own little worlds personally, to impact our carbon footprint, I guess. And so my question would be, uh, we can do that, but you also feel like, well, this is so small. I just am not going to have much of an impact if I put solar on my roof. Look at the world. It's, right where I am on the seacoast of New Hampshire, we're seeing the impact of sea level rise. Up in the North Country, they're seeing the impact of tick-borne illness because it's not cold enough for the ticks that are on the moose. We have moose here in New Hampshire. That the ticks aren't dying in the winter the way they used to, so they're actually bleeding, and the moose population is becoming anemic and dwindling. So all of these things are actually happening in New Hampshire, but we're just individual people. Is there some kind of cheerleading or rallying cry that you use with your patients and friends to say, no, every single thing you do makes a difference? How do you handle that?
Yeah, I mean, so to your example, the solar panel, right? And this gets back to the visibility of what we do. I would say it isn't just the fact that you've made that individual action. Your solar panel is actually visible to everybody else. It's like, oh, well, I know certainly when I see other people, when I see people riding electric bikes, when I see people with solar panels, I feel like, oh, these are my people. Like, we get it. We're all in it together. So I would say that these actions that feel like it's just you doing it, add something else to it in terms of the visibility, so that it isn't just you having action, it's you bringing other people into what you're doing and why you're doing it. And yeah, right. Any of these big problems we're dealing with right now, whether we're talking about guns or access to reproductive control or other ones, other these big structural problems. What I often tell people is, you may not think that your one conversation or your one action mattered, but you just don't know what that person's going to encounter down the road. I remember when I was in medical school, we didn't have recycling within our hospital. And so I would like finish a can of soda and I would just put it and tuck it into my bag. And I didn't say anything about it. But my colleague, my fellow student was like, well, why do you do that? And I was like, oh, because I have recycling in my apartment. And then he started doing it. And then his friend started doing it, right? These small things that we think don't matter. Other people are watching us. And all of us on this call, particularly if you're respected, people want to emulate the people that they respect. So I tell people, don't think your actions don't matter. They really do, because we're all watching each other and we're all looking for the right way to handle this crisis.
Yeah, and Lisa, one of the opportunities that you probably don't know about in New Hampshire is that we have the third largest popularly elected legislative body in the world. And our legislature for 1.4 million people is 400, our House of Representatives. So in addition to voting, I would encourage everyone to run for office.
Yes.
It's a lot of fun. You get to meet some really great people, and you are given opportunities to make a difference. If all you have to do is look around New Hampshire right now and recognize that we're on a completely different graph on our climate initiatives. We're one of the only states, if not the only state in New England without a plan. So there's a lot of opportunity for people who want to run for office, and feel free to hit me up for any advice you might want. But there's a great question from Lois Cody. I hope I got that right, Lois. I am retired, so don't have client patient direct contact. What I would like to be part of is helping people become aware fully of our climate crisis and be a part of a supportive, she just jumped, a network, a sort of group plus buddy system to help people stay engaged, studying candidates, voting, etc., as well as a place of reassurance, self-soothing, and reframing for hope that they can turn to for help coping with climate anxiety. Do you have that kind of citizen support group in your region or in your facility?
So I would say that this group probably serves that purpose here. We at the consortium have some resources as well. There are other organizations as well. The most important thing, find the people that you want to advocate with, right? And so there's so many organizations now. There's Citizen Climate Lobby, for example. They have a health arm as well that does some advocacy. But the most important thing is once you find a group, really try to join those meetings, join in on those action alerts, learn who the other people are in the group. But I would say this group, this webinar that you came from is a great one to develop that buddy system.
And Joe, I think this is probably going to be our last question, unless we have one more burning one. But Joseph Kwasnick, sorry, Mr. Kwasnick or Dr. Kwasnick, or if I just butchered your last name, but here in New Hampshire, we have a GOP and something called the Free State Project that refuses to recognize the reality of climate change. And in fact, Joe doesn't mention that here, but one of them is the chair of House Science and Energy. Or if they do, they believe there is no need to act now. Is publication or dissemination of the impacts of climate change on human health a means to further rally public support for action on climate change?
So I two-part answer here. First of all, we know from the data that there's 10% of the population that is immovable on this topic. They are deniers, and they are not even worth our time or energy. 90% of the population in some way, shape, or form is either hugely engaged on this topic or is tippable. So focus on that 90% and leave the 10% aside. They are just not worth our time and not worth sucking our soul out to try to convince them otherwise. But the second part is, yes, we know from the data, the people that the Democrats are on board, independents and Republicans, we can get on board because we know that the health message crosses bipartisan lines. Health and the economic message are the most powerful ones to build bipartisan support. So absolutely, framing this as a health message is for the voices that are willing to listen, that are convincible, it is the most convincing message to provide.
Thank you so much, Lisa. I'm looking for any more hands. I don't see any more questions in the chat. We're pretty much out of time. So I wanted to thank Emily and Bob for putting this together. This is very excitingly, this is the inaugural event for the Chicks component, and just what an incredible launch. Lisa, it is such an honor to have you here with us. Thank you so much.
Thank you all for inviting me, and good luck. We're excited to see how this program unfolds.
Thank you very much.